Everyone, the topic of my presentation is vision-related quality of life in patients with glaucoma. This was a study done in CMC. I'm from CMC Ludhiana. So glaucoma is a group of progressive optic neuropathies resulting in changes in optic nerve head, initially involving the peripheral vision and eventually the central vision, and it's a chronic and potentially blinding disease. Because of this reason, glaucoma significantly impacts the quality of life, and hence it is important to assess the quality of life in patients with glaucoma. So quality of life is determined by GQL15, which is Glaucoma Quality of Life 15 questionnaire. It consists of 4 factors, which has a total of 15 items. These are the central and near vision, peripheral vision, dark adaptation and glare, and outdoor mobility. So this is the questionnaire of the 4 factors and a total of 15 items. Aims and objectives, it was to determine the quality of life in glaucoma patients according to the severity of glaucoma, mild, moderate and severe. This was a cross-sectional study done in CMC Ludhiana, and it included 150 subjects diagnosed with glaucoma and on treatment for at least 2 weeks. Exclusion criteria was any other disease affecting the RNFL layer and any other significant systemic chronic disease. And ocular and systemic history was taken, ocular examination was done, and including visual field analysis. And according to the mean effects on the visual field analysis, the subjects were divided into mild, moderate and severe groups, and GQL15 was administered to all the subjects to assess the scores. So research and analysis, the age significantly increased in mild, moderate and severe, suggesting that older individuals are likely to have more severe glaucoma. In gender, the significance was insignificant, the difference was insignificant. Education level, it was seen that the higher level of education were associated with milder glaucoma, while lower education levels were correlated with more severe disease. Number of anti-glaucoma medications increased significantly with the severity of the disease. In the GQL15 score, this was the average score, 23. This was out of a total of 75. The average GQL score in mild, moderate and severe group was 19, 21 and 28, and this difference increased significantly from mild to severe, and suggesting that the quality of life worsened with increasing severity of the disease. In the subscales, it showed that the most difficulties were faced in the areas of dark and glare adaptation, followed by peripheral vision with better function in outdoor mobility and central near vision. This correlates with the natural history of glaucoma, as the peripheral vision is involved first and later involves the central vision. So in summary, age difference was significant. So that means older individuals are more likely to have severe glaucoma. Higher education levels were associated with milder glaucoma, and lower with more severe disease. Average GQL15 scores in mild, moderate and severe significantly increased, indicating a worse quality of life with the increasing severity of glaucoma. And the most affected domains were dark and glare adaptation, followed by peripheral vision. So in discussion, it remains one of the leading causes of irreversible blindness worldwide. And there is a need to assess the quality of life for a more holistic approach to glaucoma, in addition to the control of IOP and visual field analysis. And so early detection, effective treatment, and there needs to be a more patient-centered care in mitigating the disease burden. And preserving quality of life should be considered an essential goal of management, equal in importance to slowing the progression, and there needs to be further research on developing culture-sensitive, cost-effective interventions that prioritize patients' daily experiences and overall well-being. Thank you.
So you have rightly mentioned the education level. Right. What about the economic level? Because these glaucoma patients, they are on, sometimes they are multi-drug, right, and that cost is too much for them.
Yes, so we did not take the economic account as such, like we did not divide.
No, Kupuswamy economic scale, how much is the earning, that could have been included in the questionnaire and it could have been done easily.
Yes, so indirectly, like they are related to some education level to some extent, but we did not include the economic factor as such, the scale as a.
That is important because the severe ones were using 4 anti-glaucoma medications.
Yes, yes, ma'am.
almost. So
Yes.
the cost of it is quite more. So, and cataract patients are also included in this because you excluded only the retina and other comorbidities.
Yes, ma'am, only the ones very severe disease, only the diseases affecting the nerve fiber layer. Cataract patients, we did not take patients with very severe cataract, maybe just with NS1 to 2, not significantly affecting the vision. And only those patients were taken which were able to do the visual field
Because the
analysis.
glare and dark adaptation that would be affected
Yes, yes,
in those patients.
okay,
Okay.
thank you.